Today we're going to discuss various causes of tennis elbow and how you can combat it using evidence-based stretches, massages, mobilizations, exercises, and establishing healthy habits. Let's get started. Tennis elbow is a blanket term used for pain at the lateral epicondyle of the elbow. This pain can be highly frustrating and seemingly endless. In fact, if gone untreated, this pain can last from 6 months to 2 years. To get back to living your life pain-free, we first need to discover the cause of your pain and address that issue head-on. While most tennis elbow pain will be due to tendon damage, it may be important to tease out which muscle and tendon is irritated so you can modify your activities accordingly. Other sources of pain could stem from the elbow joint capsule, a hypo or hypermobile radius, or radial nerve irritation. As this research article clearly states, one size does not fit all when it comes to tennis elbow management. To see which muscle is involved in your pain, place your hand out, palm down, and curl the tips of your fingers. In this position, you will push down the back of each finger one at a time. If you have pain near the elbow when you push the index and middle fingers, it is related to the extensor carpi radialis brevis muscle. This muscle helps to pull and extend the wrist. If there is pain while pushing the ring finger, the extensor digitorum is involved, which works to extend the fingers. If you just have pain only while pushing the middle finger down and the pain is more in the forearm rather than at the elbow, the radial nerve could be irritated. This nerve comes down the back side of the forearm. Another movement that often causes pain is supination of the forearm, in other words, moving your hand from palm down to palm up. The interventions today will be targeted toward relieving pain through these areas. Stretching is a great thing to incorporate into most rehab programs, and the elbow is no different. A great way to decrease pain and improve muscle tolerance to movement and activity is to perform rhythmic stretching of the wrist extensor muscles. The rhythmic pattern of the stretch gets the muscles moving without increasing pain significantly. It is a form of dynamic stretching similar to what an athlete would do prior to a sporting event. To perform this stretch, bend both of your wrists and place the hand of the painful arm on top of the other, and begin with your elbows bent. As you extend your elbows, you will stretch the extensor muscles along the back of the forearm. This stretch should be done first thing in the morning and before any vigorous activity. Do 10 to 15 stretches and hold the stretch for 3 seconds. The stretch should be performed at least 2 to 3 times a day while the pain is high. To progress this stretch, bend the wrist of the painful arm and point the wrist to the side. Cup the hand with your other hand, beginning with both elbows bent. As you extend the elbows, you will keep the wrist on the painful side bent. This will put your wrist in a pronated position and include a stretch for the supinator muscle. If you are experiencing pain with the stretch, tilt your head to the painful side, which will decrease nerve tension that could be present in the arm. Radiating dull, achy pain throughout the arm with occasional intense burning pains may indicate some radial nerve irritation. This nerve innervates the wrist extensors, and its pain will be felt differently. Typically, when it comes to tennis elbow, people can point out one specific area of pain that will be near the lateral epicondyle of the elbow. Regarding radial nerve pain, the pain will be more diffuse throughout the arm and will be found a little further down the arm rather than at the elbow specifically. With a tendinopathy of the elbow, you will see the pain in the elbow and weakness in grip strength. A person with nerve pain will typically experience pain without weakness in the arm. However, most people will report that the forearm feels fatigued. The nerves can get irritated if the muscles around them are strained and putting pressure on the nerves. To address this, we want to calm them down. Radial nerve glides will provide light stimulation to the area and help calm down the nerves. Research shows that nerve glides can help to decrease pain in the lateral elbow. If you have high levels of pain, you should begin with your elbow bent. Flex your wrist forward and deviate it to the outside. You should only feel a light pull along the back of the forearm. If this feels okay, you can glide the entire length of the nerve. This movement will involve extension of the elbow and shoulder, flexing the wrist down and to the side, and tilting your head to the side of pain. Tilting the head to the other side will increase tension in the nerves since the nerve stems from the neck. We want this nerve to glide back and forth through the arm with little to no pain. Perform 2 to 3 sets of 10 to 15 repetitions every morning and before strenuous activity. Transverse friction massage brings blood to the area, stimulates collagen remodeling of the tendons, clears out chemical irritants from the area, and relieves pain. The pain receptors of the nerves will temporarily be inhibited by the feeling of the massage. You probably have experienced this sensation the last time you bumped your arm or leg on something and then rubbed it to decrease the pain. You want to perform a massage that is deep, tolerable, and rhythmic. This can best be done with a hard ball. For best results, you should have the wrist in flexion and deviate to the pinky side. The elbow should be at 90 degrees with the shoulders slightly abducted. Roll up the muscle, and once you get to the point of pain, sweep the ball off the arm. Perform this massage for 2 to 4 minutes if your pain is high. Once you tolerate it more, you can work up to 10 to 15 minutes. Maintain your pain levels at or below 4 out of 10 during this massage. Sometimes all the elbow needs to be able to move without pain is a little mobilization of the elbow joint. Mobilization with movement puts things in an optimal position to perform the movement. Often, the simple intervention can make a huge difference in the ability to grip and move without pain. If you don't have these bands at home, you can perform this exercise in a gym, or you can use a belt or a tied-up towel. To perform this, lay on your back with your elbow extended and palm down. Squeeze a ball or a weight to determine your pain level. Now place a band around the upper part of your forearm, just under the elbow, and bring your arm toward yourself. The band will pull the forearm to the side and decrease the stress felt in the joint. Perform 6 to 10 grips, holding for about 3 seconds, followed by 6 to 10 repetitions of wrist extensions. Over time, irritation in the arm will die down with the use of this intervention. In addition to stretching, massaging, and mobilizing the muscles and nerves, it will be important to exercise and strengthen the muscles of the arm. According to research, a mixture of isometric, concentric, and eccentric exercise is best to combat localized weakness and pain in the lateral elbow. Specific movements include wrist extension, supination, and grip strength building exercise. Along with the exercises specifically for the elbow, recent evidence suggests a need to address other areas of the body that, when weak or immobile, may lead to compensation at the wrist and elbow. Shoulder external rotation weakness, scapular or shoulder blade muscle weakness, and thoracic or upper back stiffness can force people to strain at the wrist in order to produce movement and force. For a more in-depth video on how you can apply these key exercises to get rid of your elbow pain, check out the link above. The last intervention may be the most important, and that is establishing healthy habits. People who perform repetitive movements, such as manual labor employees or athletes, may need to find modifications for their movements, such as using the other hand for a while, or lifting with their palms up rather than facing down. These little adjustments allow the wrist extensor tendons to rest and recover. This is also the case for the gym goer. Perform fewer repetitions or use a lighter weight for a while. In some exercises like the lateral raise, even subtly changing the angle of your hands will make a huge difference. If you are wondering if an arm brace will help you, the answer is yes, in some cases. If you have a pure tennis elbow with lateral epicondyle symptoms that you can point directly to the location of pain, the brace will take the stress off those tendons and provide some relief. However, if you have radial nerve involvement, this brace will press on the point of irritation and increase symptoms further. Another reason your tennis elbow may not be healing is because you're not providing an environment conducive to tissue recovery. High levels of stress, lack of sleep, and general inactivity can be leading to your prolonged tennis elbow. Providing your body with the proper nutrition and blood supply will help it in its ability to heal itself. Consider making modifications to your general health as an intervention to improve your function and allow your body to heal. That's it for today's video. I hope you found these interventions helpful in alleviating your tennis elbow pain. Make sure to subscribe so you don't miss out on future evidence-based health and fitness tips to help you get back to living your best life pain-free. Let me know in the comments below which interventions today helped you out the most to decrease your tennis elbow pain, and make sure to consult with your local physician or physical therapist before beginning any exercise treatment, just to make sure that it's the right one for you. We'll see you in the next one.